Hey, you guys, welcome. So, we're going to talk about introduction to assessment today. And this is going to be kind of a general overview. And probably more than anything, maybe it's going to be a description of the philosophy of how we understand counseling. I'm not going to necessarily go into specifics about what are the philosophical principles and all that kind of stuff. But hopefully, by the end of today, you'll have a better sense of why do counselors do assessment? How do they use it? What's the purpose of it? What's the function? Because our profession is not totally different than other professions like psychology and social work and that kind of thing, but there are nuances about why we do these things and how they matter. So, uh, for those of you who don't know, who aren't specifically in the course right now that I'm using these videos for, we're using, hold on a second. This book, I know you can't see it because I'm using a green screen, which kind of is weird, but that's what I'm doing. Carl Sheperis is the author of this book, and it's Assessment Procedures for Counselors in Helping Professions. The thing that counselors really, I think one of the things that is distinguishable about a counselor versus a psychologist in social work or whatever, psychologists do a ton of training in assessments and develop a lot of the assessments that we use. So in terms of like who's the expert in assessment development and usage in these very objective and scientific ways, psychologists, absolutely. The thing about counselors is that we're sort of specifically trained, and I won't say designed because that doesn't really make any sense, but specifically we build this sense of like, how do I gather information about what's going on in the person's life and about what they're doing and how they're behaving and how they're feeling and thinking too. How do we do that and then use that to inform our treatment planning practices? So what we're doing here is we're essentially building some muscle memory, if you can excuse that term. We want to take in information so that we can use it in meaningful ways. That's kind of just generally speaking, that's what we're aiming for. So what that looks like is that when a person comes in to see you for the first time, you're like, okay, maybe they went through a little bit of a screening process. They took a Beck's depression inventory or PHQ-9, and now we know a little bit about their symptomology for depression. Let's just use that as an example. And then we say, okay, well, are they depressed? Well, I'm not sure, because you can't just take one assessment that's filled out in the waiting room of an office, self-report by the client, by the way, and say, oh yeah, they said they're depressed, so they're depressed. Well, we can't do that because as professionals, we need to be able to see people and be able to interact with them and say either they are as depressed as they said they were or they're not. So apologize about that. If you could hear that, that was my phone going off in the middle of a video. How classy, right? um, but on the flip side, we may look at them and be like, oh, you're way more depressed than you said you were. So we need context, right? And so the assessment is a process. It's not just one thing. So this is kind of the second point here. It's an ongoing fluid dynamic process that continues through the relationship. So the reason we would do that and the reason we would then say, well, okay, self-report assessment, great. Now I need to do my own interview and use the way I understand you and the things I know about diagnoses and the things I know about career planning and the things I know about from my professional training and experience. Now I can apply those to what a person's doing, things that they don't know about themselves. So self-report is great. Then I interview, then I learn a few more things, then I might even choose to do another assessment. So it's this ongoing thing that we continually process throughout the relationship or counseling experience, whatever. There's a ton more to say about that, but we'll save some of this for later. Counseling, it's more than just giving tests. So part of it is giving tests. We might use a screening tool before we even see them. After we see them, we do our interview and we understand and learn a little bit about them. And then we might say, you actually have something really complex here going on. Let's pick up this other tool to find out more information that neither one of us can know right now. So let's say, for example, somebody comes in and they're looking for a new job. And I'm a rehab counselor by background, by the way. And what that means is we often work with people with disabilities to build independence through vocation or through getting work and maintaining work. So part of that is, okay, you want a job. Now we need to understand a little bit about what your limitations are. So we assess that by looking at medical records and some of those other things, and they tell us what's going on too. And then we say, well, what kind of job can you do? And they say, well, I went to high school And now I've worked as in a factory for, different factories for a few years. And we say, okay, that's great, but what skills do you have? And they're like, I don't know. And so, or, what were your best subjects in high school? And they're like, well, I got A's in all my classes, so I don't know what my best is. And so then we might say, okay, you're not sure what your intelligence level is or your aptitudes for doing certain kind of work or what kind of things you'd be interested in other than the work that's immediately available to you. So now we can pick up a career assessment or an intelligence assessment or aptitude assessment, and we can gather that other information. It would be like a doctor saying, what's going on? I have a cough. And he says, okay, show me. And you're like, and he's like, oh, you do have a cough. Does that mean you have a cold or do you have cancer? And he's like, I don't know. We have to bring in some other tools here to gather further information. So it's more than just simply giving tests. It's this back and forth process of like, sometimes you use a very objective standardized measure. Sometimes you use your gut intuition based on your theoretical background. For example, what that means is that, let's say I'm trained in cognitive therapy. And one of the things we know about cognitive therapy is that we can maybe say the grandfather of cognitive therapy is Aaron Beck. Aaron Beck said that a lot of our life problems stem from dysfunctional thinking or thought dysfunctions. If we theorize that this person has some dysfunctional thoughts, then we can take in an assessment and ask about what kind of dysfunctional thoughts are you having? Is it black and white thinking? Is it, you name one of the other ones, Google them, and there's a bunch of them. If we use that theoretical perspective, then we know kind of what we're looking for. We can put those CBT or cognitive therapy glasses on and look through those lenses to see maybe we can spot some of those cognitive dysfunctions in the way a person is talking. So our background is important, our training and experience is important, plus those cognitive measures too. So all of these things play a part in the assessment process. I think I've kind of mentioned this already, but a systematic procedure for collecting, organizing, and making meaning of data. Information by itself is meaningless until we organize it and do something with it. Take, for example, let's say you have an Excel spreadsheet with a whole bunch of information on just random numbers all over the place. And then all of a sudden you say, well, if I can organize it and put all the names in this category and all the ages in this category, and then all the, I don't know, like how much money someone has in their bank account. It seems silly, but whatever, we'll just go with it. If we can put all those in order, all of a sudden we can see that different people with different ages make different amounts of income. The younger people make less, the older people make more. And that makes intuitive sense to us. But when it's all jumbled up on a screen, we just can't tell. So the point is that even with psychological assessments, somebody might be able to tell you a whole bunch of information verbally, but until we do something with it, most of that happens automatically in our head. But until we do something with it, we just can't know. A very simple example that we'll use to sort of foreshadow down to the end of the class. If somebody comes in and says, I'm not mentally ill, and we're like, okay, tell me why. And they tell you this story and they say how functional they are and how impressive they are and all this kind of stuff. One of the things we can keep in the back of our mind is that, do they have the level of insight to know what mentally ill means? Or do they have motivation to be kind of untruthful with us? It's common for people to say, I'm here court appointed and I have to look as healthy as possible so that when I go back and talk to the judge, he won't take my kids away, or he won't force me into treatment, or he won't make me do things that I don't want to do. So there's all kinds of incentives and motivations. What that means for us is that we have to find out a way to tell if they're telling the truth, if they're managing their impression to other people out with I guess malicious intent is not really the right way to say it, but with other motivations. So we develop some tests in ways that can assess that kind of thing. Are they being truthful? Are they taking this assessment seriously? Are they just marking everything down the left-sided column? Are they being inconsistent about their responses with very similar questions given in different places? Are they fatiguing throughout the test? So that's affecting the validity or the results, whether they're even accurate or not. So all of this collection and organization tells us new and different things. That's the whole point of it, is to collect it and organize it and categorize it so that it means something. That's kind of the point. Testing does not necessarily equal assessment. And if you're following along in the book, it's on page 3. But Testing is a different process. When we use the term assessment, and by the way, I might use some of these interchangeably, and I'll tell you why in a little bit, but assessment is that ongoing fluid process. Testing is a very formal, standardized process of gathering information in a very specific way with every single person down the road so that we can compare each person to each other. That's part of the statistical process called norming. We'll talk about that a little bit too later. But just so you know, those things are not mutually exclusive. All right. So there is another bit of terminology that we might use. Screening. I've already kind of mentioned it, but it's usually done before the relationship is established. It's usually really quick. Probably everyone has gone into the doctor's office and they've given you a clipboard to sign out. They're screening you for a family history of certain kinds of diagnosis. They're screening you for self-report results of the Beck's depression inventory, like we've said, or the PHQ-9 or the GAD-7 for anxiety, that kind of stuff. Basically what that means is we just want to know some helpful information up front to help us make some very initial decisions. It should be quick and it should be simple. Again, we've already mentioned this, but the purpose of assessment is for identification and diagnosis. Does that mean just mental health diagnosis? Absolutely not. It could mean a whole host of things. Identification just means how do we understand what the person's initial complaint is and potentially underlying issues. So somebody might come in and say, I'm just having a hard time with life right now, and I think it's all my boss's fault. And you're like, okay, well, I can identify this is related to careers. It sounds like it's an interpersonal kind of issue, but do I know what's really going on? And after a few sessions, you might find out that there's this I'm just coming up with this off the top of my head, but you find out that your client is in love with somebody else who your boss is having an affair with, who's also not the boss is their superior. So there's like this work relationship and personal relationships and a whole bunch of, it just gets messy. Is that a diagnosable issue? No. But is that something worth talking about and working through with a therapist or a counselor? Sure, of course it is. We just call it something else in terms of diagnosis, but that's another topic for another day. But it could be identification of whatever the issue is. So in my rehab world, I'll give you this just a little bit of background. In my rehab counseling world, where we talk a lot about careers, it might be, I can't get a job. Well, why can't you get a job? Maybe it's a person's interview skills. They just get nervous, but they're a really good employee. Or maybe they go into the employment interview and they're super confident and they're just coming across as kind of cocky, even though that's not how they are in real life. Or maybe they look good on paper, but in real life, they don't really have all the skills necessary to perform that certain job. So there's all kinds of different identification issues depending on the field and the job setting specifically that a person's working in. Excuse me. It can be used for intervention planning. I've already kind of mentioned that. So like if a person has certain symptoms, those symptoms can be specifically treated through certain kinds of interventions. So I think that one's probably pretty straightforward to most of us, but it's worth noting. Progress and outcome evaluation. Not only can a screening tool be used when you walk into the doctor's office or into a counselor's office, but it can also be used later on. Because if you say, well, we've had 6 sessions now. When you came in the first time, you were at this baseline. Your depression, your PHQ score was 17 or whatever. And now it's actually down to 13. So that means that seems like your symptoms are reducing. We maybe still have a little bit of work to do, but here's the outcome of what 6 sessions has afforded you, whatever. So it can be, some assessments are sort of one-time deals and other things can be used ongoing at different time intervals, which is something we'll talk about later too. Now this part, we're going to go through this in more detail in a future lecture, so I'm not going to spend a ton of time on this because, again, I don't want to repeat myself too much, but there are lots of different ways to gather information. We've already talked about interviews, but interviews have different flavors too. They can be this free-flowing conversation that people have that doesn't really have any structure, and you sort of let the client go wherever they need to, and you follow them, and you say, okay, now that you're telling me about this, I have a question about that. And, it just sort of like, it's like going for a stroll when you have no particular destination. On the other hand, you might have a list of questions in front of you that you think are really relevant, which we, again, will talk about in this class. It might be that as a counselor, you know that a person's family background is kind of important to how they develop and what's going on in their life currently. So, just wild example again. Let's say a kid grew up in school. He had loving parents and a couple siblings, and they had a white picket fence, 2.5 kids, and whatever. And but they got bullied in school, and you're like, okay, tell me about how your mom and dad responded to the bullying in school. And they were like, well, they just didn't really seem to, like, they thought the teacher should deal with it. And now I'm at work in my future life, and I'm having a hard time with this coworker, and I'm waiting for my boss to deal with it, and they won't deal with it, and I'm not sure what to do. So there's all these kind of like the way life happened before, and the skills you use to cope with those things then show up later in life, and that gives us insight, right? So we might say we have a list of questions about your background in school, families, your medical history, that kind of stuff. So we might have a little bit of structure that we actually need to apply to an interview. There are some interview assessments too that are very, very structured. For example, if you're doing a post-traumatic stress interview, which in the class we'll practice one specifically, but if you're doing a PTSD assessment and you want to find out, do they meet diagnostic criteria based on the DSM-5, which is kind of our we'll just call it the mental illness Bible. One of my favorite quotes was, I think it was Albert Ellis. I read this once, that Albert Ellis, who is the sort of the grandfather of REBT, or rational emotive behavioral therapy, he used to call the DSM the big book of unhappiness, because it's just all pathology and people's problems and all that kind of stuff. But that has a specific function in our therapeutic world, right? Like we need to use that in terms of being able to communicate with other professionals about like-minded things. And so we have these assessments that are very structured, that meet the specific diagnostic criteria for certain conditions. And so if you go through this assessment, you follow the questions and you do follow the steps, then you'll come out and say, yes, you meet the criteria for this diagnosis very specifically. And if you deviate from that, that can then become problematic, because then you may not get the right answers that you're looking for. So there's all kinds of different interview styles, basically. Then there are tests, and we talked about that just briefly a second ago. There are standardized tests, which means they're delivered. They're built to be given the same way every single time, and that's important for certain reasons. I'll explain those later. I can make my own test, like based on my information of, let's say, internet use addiction or gaming addiction or something. Let's say I can't find a test out there, but I know there's a series of questions that helped me understand the issue better in the past. So I make up my own little test to say, how's it going in terms of your gaming use and the kind of games you play, whatever the thing is. Could be a checklist, a questionnaire, projective drawings, work samples. There's all kinds of different tests that we can use for finding out more information. By the way, if you're wondering what that work examples is about, that's one that's a little more confusing to people. When I'm doing a rehabilitation counseling assessment on somebody's career potential, let's say they come in and they say, I want to go work as an auto mechanic. I want to get that job. And you're like, well, you only have 3 fingers on one hand. They're like, yeah, but I do just fine. I can do any of the things that auto mechanics do. And so I say, well, I have some wrenches in this little toolbox here, and I have an impact wrench, and I have some power tools, whatever the thing is. Show me that you can use these things, and they do, and you're like, oh yeah, you're fully capable. That was a sample of mechanic work that I'm now using to show competency in that skill set. So it would then be appropriate to say, okay, let's go look for a job as a mechanic. That's a very inaccurate example of how that actually works, because it doesn't work that way exactly. But you get the idea, hopefully. We all know what observations are. You watch people and you you rate their behavior or their performance on something. You can record things for a certain time period. You can record them over time. Time sampling, raw notes, anecdotal records. There's all kinds of ways that you can watch things happen and observe behavior in real time or in real life. Then there are different sources of information. One is the client. We referenced that earlier. But there are reasons to be both believe somebody else's personal truth and also reasons to believe that they have motivation to not be truthful. Both of those can be true, depends on the situation and the circumstances, but that's a very important source of information. This book uses the term collateral sources, and I'd say that's a pretty universal term, but not everybody thinks of it this way. But if you're working with the kid, his teacher, the professional sources like this one down here, they're teachers, they're other counselors if they've seen past counselors, doctors, etc. Anybody else this person has worked with in their life. Another one is personal resources. If somebody comes in with their boyfriend, he might be somebody to ask questions about. If somebody's coming in with a spouse or a family member, whatever, all of those are sources for information. And then there are records. Most of us know what records mean. Could be medical, they could be educational. There's all kinds of that kind of stuff that where we can gather information. One of the things we talk about in the class later on specifically is what kind of information can you get from records? Because sometimes it's a scribbled note from the teacher that made the referral to you. That referral is pretty important information. Why are they being sent to you? Is it bad behavior? Is it struggling with math? Is it social kind of stuff? Those are all pretty helpful in terms of us then giving our counseling trajectory. In other words, what do we talk about? What things can we work on? That kind of stuff. Another thing is other people may have given assessments of different kinds, educational, diagnostic, whatever. And part of our role then is verifying if that's accurate. Do we believe that bipolar 2 diagnosis? Do we think somebody do I know that this school psychologist does excellent work and I can trust his results without having to spend a bunch of time, making sure it's true? Those are questions that get to go through our heads when we're looking at records and evaluating other people's assessment of a client we have. We've already done a bunch of talking about this assessment process, so I'm not sure how much of this I want to go through. We've already talked about identifying the problem and the sub point there. Selecting assessments is something that we'll cover later on in the semester too, once we go through a few of these and talk more about the statistical processes and some diversity and multicultural considerations too. There's a bunch of different things to think about when it comes to selecting tests. So this will be one of those sort of ongoing discussions that we'll get into. But let me just look through this here to see if there's anything relevant that I want to talk about. If you can't find enough information through other means, here's an example of that. Let's say I want to know how smart somebody is. And I say, okay, how smart are you? And they're like, I'm pretty smart. And I'm like, okay, well, that's good to know, but it doesn't really give me enough detail, right? Like, can you do math? Yeah, I can do math. Can you read? Yeah, I can read. Okay, that's a little bit more level of detail, but I still can't get enough of it, right? And so one could imagine that you could ask a bunch of questions and like get at a whole bunch of detail, but even sometimes I don't know the right questions to ask, or I can't ask questions to get at a certain kind of information. And the person certainly doesn't know how to answer all the questions we may have. Like, how good are you at spatial reasoning? They're like, what? What does that even mean? You know what I mean? Like, they just don't even know. We can't get at that information without having some other tool at our disposal. So the question is, couldn't I just grab a hatchet and whack someone in the head, split open their skull, and look in and be like, oh, that's the spatial reasoning. I see it now. Well, you can't do that, right? Like, that's not realistic to think you can do that. But what I can do is I can give them a series of colored blocks and tell them to make shapes, or tell them to, in their mind, they can imagine what a certain shape would look like if it was in a different orientation. Those kind of things we can do. And we can learn about the things that are going on. Excuse me again. We can learn about all those things that are going on up in the noodle without breaking it open and without having the right words to put to it. So some tools are specifically built to get at those things that we have no other means of getting to. So that can be a really important reason for using some of the more complicated standardized testing tools. Another reason that we use certain kind of methods is to get a large amount of data and understand what it means across geographical areas through time or something like that. For example, let's say I have to make some really important political decisions about funding certain kinds of schools, which is a real thing that happens. And let's say there's a bunch of people in Washington, D.C. who say, well, how are schools doing? How do we know if we need to put more money into math or English? Like, what do we do with that? And so we have to have a tool that is standardized. It's going to be used to compare people across the country, both from different backgrounds, to different ages, to different, geographical area, all kinds of stuff, right? So we might use a specific tool because I can't just call up every school in New Mexico and say, how are they doing in math? You know what I mean? Like I need a process to gather that mass of information. Or I might say, how is a school doing through time? I can call them one year and then wait for 5 years, or I can just sort of give them a test now and then give them another one later and find out how do they compare after doing some intervention or providing some program resources or something like that. So in other words, there's lots of different reasons of why I can't access certain kind of information unless I use some specific tool. So we'll go more into that as well. Reporting and recommendation number 3 down here at the bottom. I think I'm going to skip over that one because we'll cover that one later in much more detail. Yeah, I think I'm just going to skip that one for now. If you're looking in your book on page 11 and 12, there's a list of competencies. There's also another list on page 30 and 31. The reason why I leave these here and don't actually list them all out is because there are a ton of things that we are expected to be able to do as counselors. However, what you actually are going to need to apply, depending on your various occupation or specific job, might be a little bit different. So these are kind of overwhelming lists when I look at them, and there's all kinds of information about what's the bare minimum I must be able to do to enter the field and be able to do everything. And so I don't put them up here specifically because, for one, I don't want to overwhelm everybody, and for two, it's important that you can go through those lists and do your own sort of self-evaluation. So I can't really say much more about those. Actually, I can open it up and give you an example of what some of them say. But what this is for is for you to go through and evaluate for yourself what that means. So here's one, though. Understand basic statistical concepts and define, compute, and interpret measures of central tendency, mean, median, mode, variability, like standard deviation, and relationship from one number to the other. So we'll do that in class. We'll get to that later. Do you feel good about that now? Probably not, because you, unless you took specific statistics classes elsewhere, you may not feel confident about that. Here's number 3. Compute and apply measurement formulas such as the standard error of measurement and the Spearman-Brown prophecy formula. I know kind of what the Spearman-Brown prophecy formula is, but I can guarantee you that I probably won't use that within the next 10 years of my life. Maybe I will, maybe I won't. But does everybody need to know that in order to become minimally competent? There's an argument to be made that no is the answer. Some people will say yes, absolutely. And so this list to me is not like you must be able to do everything, but it's a pretty comprehensive and a really good list about like what should you be able to be ready for to be a fully competent counselor in the area of assessment. So take a look at those. We'll talk more about those in class probably. Well, maybe. We'll decide if you guys want to. Another important but also semi-controversial topic is testing qualifications. Here's what that means, basically. If you know what the PHQ-9 is, the Beck's Depression Inventory, you've probably taken them before. It's like a 21 question. There's different versions, I guess, but the 21 question test that you can self-report, that a client could self-report in the waiting room. I was talking about that earlier. There are also tests that have to be administered in a very standardized way. Let's take the WAIS, or the Wechsler Adult Intelligence Scale. It takes a long time to do it. It has to be administered in a very specific way using some unique skills that are a little awkward to perform the first time. So it takes a little practice. knowing how to score the assessment is complicated enough. If you've ever done that in on paper, it's challenging to figure it out at first. And then the biggest one and the most important one is, what do those scores mean? What are the scales? What are the subscales? Do you understand the theoretical foundations for what people think intelligence even is? Because not everybody agrees on that. And then do you know, what does that mean for this person? In other words, it's not just about finding an IQ score, it's about understanding what specific kind of learning disabilities might a person have. Is it dyslexia, a certain kind of dyslexia? Is it dyscalculia, which is like a math learning disability? Those things are pretty nuanced, and there's so much more to talk about there. But it's a really complicated test that requires practice. It requires supervision by somebody who's competent. It requires ethical use of it because they're high stakes, which means they could be used to affect people's lives in really meaningful ways. And so you can't just go in thinking you can do these very complicated tests, right? It's like, if you were a doctor, could anybody go in and say, you have a scrape and you need a Band-Aid? Yeah, probably, right? That's why they're over the counter and you don't need a special medical degree to diagnose and assess and treat scrapes. Like, put a Band-Aid on it, maybe some Neosporin, you're fine, right? But if somebody said, I think I might have some digestive issues, I'm going to give myself a colonoscopy. Like, that just, it doesn't make sense, right? You don't know what you're looking for. You don't have the right tools. You just can't do it. And there are real risks with performing an assessment like that, right? So, like, there are some procedures, both medically and psychologically, that require experience and training and all that kind of stuff. So what we have here is the result of that. There are 3 different levels of testing competency, we can call them, or qualifications is maybe better. Level A are, if a test is level A, it means you don't really require any advanced training. You could have a bachelor's degree, arguably for most of them, you could have associate's degree or even no degree at all. Some of them, like the Beck's Depression Inventory, you find it on the internet, you can take it, fine, whatever. Level B typically require a graduate degree, which is what we're working on here. Or, there's a comma there, but I'm going to put in or you have special training, the ability to use it, or you have related coursework. Now, here's the caveat about that. Even if you have a graduate degree, that doesn't necessarily mean you're competent to use every single assessment out there. You still need some training, right? Like, there are some pretty complicated assessments that are level B that you still will want to learn how to do them. Do you know how to give we'll just use an example, a self-directed search? Well, I would bet that maybe 90% of people here don't even know what that is. If I gave it to you, could you figure it out? Yeah, with the statistical foundations that we're learning, with learning about things like assessment process, and with having somebody walk you through it, sure, you can get special training on it and you can figure it out, right? And then you can be competent to do it. The self-directed search is a career interest evaluation, basically. So it helps people make decisions based on the kind of things they like to do and that are meaningful to them, but it helps them draw out more information that people typically have at active recall. So that's a level B test. You can use it. It doesn't have a lot of detrimental effects. There's not a lot of risk with using it, even if you mess it up. So if you mess up the test, you don't use it to its full capacity, it's probably still mostly safe to use. That's kind of the whole point here, is that, can you do those without a graduate degree? Sure, if you learn appropriately, you practice ethical practices, and you do those kind of things, you're probably fine. Level C, it basically is just, most people say if you have a doctoral degree, you can use those tests. However, I think the same things apply up there. You have to have training in it. You have to have taken courses in it, whether that's at a university or from somebody who provides training as a sort of a side gig to their business. As long as it's legitimate and ethical and all that kind of stuff, if you get that kind of training, you still might be okay. And this is one of the things that I always thought was weird is I went to, there's kind of 2 primary websites that do, like, the big sellers of assessments like this. One of them is PAR and the other one is Pearson. If you go to those, like I did when I was a graduate student, and you say, yep, I'm getting a doctoral degree and I'm trying to buy this test, and they say, "What's your degree?" And I say, "Rehabilitation Counselor Education." And they're like, "Okay, here you go." And I can literally go in and buy any of these things. Does that mean that I'm qualified to take them? That leaves questions. Have I undergone supervision by somebody trained? Do I know the risks thoroughly involved in it so that I'm not going to go hurt somebody with it? Do I have I had training and use of it once it comes to my house in the mail? Am I really going to know how to use it? Well, some tests yes, and some tests no. You know what I mean? So this is sort of a guideline, level A, level B, level C. However, the reason I'm going into this in such detail is that you as counselors, you might say, well, I'm level B and I have a graduate degree, so I can't use anything level C. And I say, well, maybe not. Other people might tell you, you cannot be giving that assessment. You're not qualified, but maybe you are. So on the same token, there might be a level B test and you're like, oh, I can do that because I have a graduate degree. And I'm like, no, maybe that's not the case. So there's a little bit of discretion in here, and there's a little bit of evaluating whether you're actually prepared to do it and what the risks are involved in it, and who is overseeing it that can help you if you kind of get stuck or get into trouble. Those are kind of important things too. Okay, switch gears a little bit. Ethical issues in assessment, also client welfare. We'll talk about communicating assessment results later, but it's one thing to say, okay, you're here for a test. Now sit down and follow my instructions. That might be okay in some contexts, but in most contexts, I would argue that it probably would be helpful to make sure that this test is not going to do more harm than good just by going through with it, regardless of what the results are. If it's going to do more harm than good, then it may not be worth even performing it. Also, if a client doesn't know what they're doing or why they're doing it or what the test results are going to be used for or be able to make decisions on their own behalf, that's kind of problematic, right? Like, you wouldn't want to go into a doctor's office and have them say, okay, we're going to do a blood test and we're going to send it directly to your insurance company. You'd be like, wait a minute. No, hold on now. What is this all about? You know what I mean? Because insurance companies can just drop you if you have a pre-existing medical condition, right? Like, that's not good. So being informed about how your information is being used and where it's going and that kind of stuff, that's kind of ethically pretty important. So we'll go into that in more detail later too. All right, that's the end, and we're done even a little bit early. So I know I deferred a few of these topics to later, but I promise you we'll get into them. And if there's anything that went on in this lecture so far that you're like, I want more information about that, feel free to bring it up in class. Feel free to email me or send me some questions in the ways that you know how. Otherwise, hopefully it was useful, and I'll just see you in the next one. Bye-bye.